My name is Genesis Morgan and I'm going to be inserting an IV. First, I would verify the order, which is insert saline lock in AM for CT scan, and then I would verify the hospital policy. Next, I would gather my equipment and perform hand hygiene, and then I would verify the patient. Jaguar J. Jones, date of birth 8/25/1963. 8/25/1963. I see he has an allergy to penicillin and an allergy to penicillin. Next, I would explain the procedure and that I'm going to be inserting an IV. I would provide privacy for the patient and position my trash can and then perform hand hygiene. And now I'm going to put on my goggles. And then I would raise the bed to a working height, lower the side rails, position the patient in a supine or sitting position. Now I'm going to open my supplies. Next I would normally tear 2 pieces of tape, which I already have right here. So now I'm going to clean the cap with an alcohol swab, being careful to not contaminate the end, and then throw that in the trash. Now I'm going to make sure there's no air bubbles in the syringe, connect the syringe, and then flush the tubing, and then place the cap back into the container. Now I'm going to remove the catheter from the packaging. Put that away and remove the dressing, and my tape is next. Now I'm going to locate the site for inserting an IV, which I would look on the non-dominant arm, on the most distal site, and I would look for a large, bouncy, soft vein. For venous distension, I would stroke the vein lightly, have the patient place their arm in a dependent position and pump their fist, and then I could also apply a warm compress for vascular dilation. Now I'm going to place a pad under the patient's arm. And I'm going to place the tourniquet 4 to 6 inches above the injection site. And I would check the patient's radial pulse and assess the vein for appropriateness. Now I'm going to perform hand hygiene, place gloves, clean gloves. Move the lock closer to the patient. And now I'm going to clean the injection site with chlorhexidine. I would pop these and then clean the site in circular, horizontal, and vertical motions with friction. I would do this for 30 seconds, and then I would trash this and allow that to dry completely. Now I'm going to anchor the vein about 2 inches below the injection site, and I would tell the patient to remain still and that they are just going to feel a small stick. So I would anchor the vein, like I said, and be careful to not touch the area that I just cleaned. So now I'm going to insert the catheter with the bevel side up. and at a 10 to 30 degree angle until I see blood return, and then I'm going to lower the catheter and advance it 1 to 4 inches more. Then I'm going to advance the hub, keeping the needle in and undoing the the tourniquet, and then I'm going to apply pressure 1 1/4 inch above the injection site and slowly remove the needle, place it in the sharps container. Now I'm going to attach the lock, maintaining pressure, and then I'm going to apply a piece of tape temporarily, and then I'm going to let go of pressure, and then I'm going to aspirate for blood return, and then I would empty this entire syringe of saline into the patient's vein, but I'm not going to do that today because of it being on a pool noodle. Now I'm going to remove the syringe and let this dangle. Now I'm going to apply the transparent dressing. Making sure that it is smooth, and then now I'm going to remove the temporary tape from the patient's arm, and then allow the tubing to fall into a normal position, and then use a piece of permanent tape to tape it into place, like so. Now I'm going to throw away everything, dispose this and this. Take off my gloves, and then now I'm going to write the date, time, and my initials and the gauge of needle used, and place this on the dressing. Being sure to not cover the insertion site. Now I would reposition the patient and lower the bed, raise the side rail, teach the patient the signs and symptoms of infiltration and phlebitis or inflammation. I would ask the patient to inform me if the fluid stops flowing or if there's any blood returned. I would let them know to protect the IV when moving their arms and wrap with something to cover it during bathing. Then I would perform hand hygiene, and then I would document the date, time, the location, the number of times or a number of attempts, the catheter gauge and length, the patient tolerance, the saline lock, the flow rate, the method of infusion if prescribed, fluids. Now I'm going to demonstrate removing the catheter. So I would perform hand hygiene, put on clean gloves, and then now I will remove the tape. And pull the dressing towards the insertion site. And also place a clean gauze above the site while I'm removing the dressing. And put pressure, and then slowly and gently pull the catheter out. Holding pressure, I would assess the catheter for intactness, and I would also assess the site for any bleeding or redness. Now I'm going to remove the dressing. And then throw it away, and then apply a clean dressing to the site with a piece of tape, and then remove my gloves. And that is it.